Hello budding pilots, Captain Saurabh Bhatnagar again. Today I will answer a very simple but crucial question. Can you become a commercial pilot if you wear glasses? And then I will walk you through the complete eye test you will face under DGCA Class 1 Medical, what's allowed and what conditions will stop you from flying commercial. Let's start with the short answer. Yes, wearing glasses or contact lenses does not automatically bar you from becoming a commercial pilot. Civil aviation standards allow corrective lenses as long as your vision can be corrected to the required standard. This is consistent with the ICAO visual requirements and DGCA practice. The primary visual rule that matters is distant and binocular acuity. For Class 1 standard used in commercial flying, the goal is binocular vision correctable to 6:6 and each eye typically 6:9 or better with or without correction. If you need glasses or contacts to meet those numbers, that is acceptable provided you wear them when exercising license privileges. These are ICAO level standards and DGCA follows equivalent thresholds in its Class 1 assessments. Color perception is tested separately because pilots must reliably distinguish navigation lights, signal lights, and cockpit indications. Aviation medical examiners use validated color vision tests like Ishihara plates, lantern test, or other approved methods. And DGCA guidance describes standard aviation color vision testing. DGCA uses graded outcomes for color perception. A failing grade in the color perception test is disqualifying for Class 1 medicals in practice. In aviation practice, a CPT-4 or a failed color perception result is treated as a permanent disqualification from Class 1 medical certification. The examiner will check your visual fields and examine the retina conditions that affect field of vision, progressive retinal diseases, active retinal detachment, or recent retinal surgery and other structural eye problems can disqualify you until they are treated and stable. The DGCA guidance and aviation ophthalmology practice require that these problems be absent or stable and documented before fitness can be certified. If you have any previous retinal surgery or disease, bring full ophthalmology reports to your doctor. Corneal opacities, significant cataract, or irregular corneal surfaces that reduces contrast sensitivity or cause glare can be disqualified. The examiner checks not just acuity but contrast, sensitivity, glare, and night vision complaints. Any persistent post-operative complication from eye surgery that affects these functions will be a problem. Many students ask, if I get LASIK, can I still get a Class 1 medical? The answer is yes. Often, but case by ICAO and national aviation authorities allow applicants who had refractive surgery to be examined, and if stable and free of adverse reports, no significant glare, halos, contrast loss, they may be found fit after an appropriate waiting period and ophthalmology clearance. DGCA practice also assesses post-surgical pilots individually. The eyes must be stable. Commonly, a minimum waiting period and a formal ophthalmology report is required. So don't assume surgery is an automatic pass. Plan and discuss with an authorized doctor first. If you need glasses, bring a spare pair. ICAO or civil aviation authorizes or these authorities ask that spare spectacle. Tell the doctor that you wear them so the record reflects that correction was used. The DGCA medical form will record whether correction is required and specify any limitation. For example, must wear spectacles while flying. So be prepared for that administrative note. What will definitely disqualify you, the things to watch out for, is color perception failure at the aviation standard, which is CPT-4. This is treated as a non-meeting of Class 1 requirement. Uncorrectable visual acuity worse than required even after correction. Next comes the progressive or untreated retinal disease, large visual field defects, uncontrolled glaucoma with visual field loss, severe corneal disease or opacities that impair contrast or safety. So now what to bring to your Class 1 medical and how to prepare? Recent spectacles and a spare pair, any ophthalmology records if you have previous eye surgery, retinal problems, glaucoma or corneal disease, a list of medications. Don't wear color tinted glasses for the color test. Follow the doctor's instruction exactly for any color vision screening. If you already have an aviation ophthalmology report showing good color perception, please bring that. Now the final practical advice. Get an early pre-checkup with an ophthalmologist before you commit to your training cost. A pre-screen will tell you if any eye issue might block your path. If you have mild refractive error, don't worry. Glasses and contact lenses are routine and permitted. If you have had ocular surgery, plan the timing with your doctor and bring full ophthalmology reports. If you suspect color vision deficiency, test early. If it's a mild deficiency, there may be acceptances in some limited operations. But for Class 1, the aviation color test standard is strict. So to close, the glasses are allowed. Your vision must simply be correctable to the DGCA or ICAO standard for Class 1 medicals. But colors perception, visual field retinal health and other ocular conditions are examined carefully and can be disqualifying. Hit like, subscribe and drop your questions in the comments. I will answer them in my next video. Thank you.